Okay, welcome everyone to the 2023 NNLM Virtual Symposium on Health Misinformation. We are glad you are able to join us today. I am Jamia Williams. I use she, her pronouns, and I'm the Consumer Health Program Specialist. We just have a few technical items to cover. All attendees have been muted, but we do welcome your questions and comments in the Zoom chat anytime. V Fairs is providing technical assistance today. NNLM staff will be keeping an eye on the chat with me. Please be sure to select everyone from the drop-down menu when posting your comments in the chat to ensure everyone sees them. Submit questions for the speakers using the Q&A function to ensure that your questions do not get lost in the chat. We have live caption going on for this event. You can access the closed captions by clicking on the icon with the 3 dots and then selecting closed caption. If you would like to share on social media, we encourage you to use the hashtag for the event, HealthMisInfoNNLM. Before we get started, I'd like to share a little about who we are. The National Institutes of Health is the nation's leading medical research agency. Many of you might be familiar with the National Center for Allergies and Infectious Diseases, which is one of the many institutes and centers at NIH. NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. It is my pleasure to introduce today's speakers, Liz Lorbeer, Ann Harris, and Juli McCarroll.
Hello, a warm welcome from Kalamazoo, Michigan. Western Michigan University, Homer Stryker MD School of Medicine, which we fondly refer to as WMed, is located in Kalamazoo, Michigan. It's a newer allopathic medical school that was founded in 2011. The school is fully accredited by LCME. Our student FTE is 336. We are a very small medical school, and we have about 84 learners a class. I'm really happy to say that the library this year is celebrating its 10th anniversary. So we are well on our way. Some information about Southwest Michigan is that data compiled by HRSA showed more than 80% of rural Southwest Michigan is medically underserved. So some of the ways that we are working with our learners to help our community in Southwest Michigan is that the medical library offers electives for credit. So today we're going to discuss about our initiatives that we have done over the past few years. I want to say that our electives are popular due to the hybrid and online learning options, which allows us faculty librarians the flexibility to offer to our learners the ability to go home for the green week or the elective week or take them while they're interviewing for residency. So today we're going to talk about these electives. We're first going to start with our English electives, health literacy, extended Wikipedia, project medicine, and the COVID-19 lecture review. I'm going to hand the presentation off to Ann Harris.
Thank you. Thank you, Liz. Hello, everyone. Good afternoon. So over the next few slides, we're just going to take a brief look at some of these elective offerings: health literacy, extended wiki project medicine, and COVID-19 literature review. Okay, to begin, as we know, health literacy is the ability of an individual to access, understand, and use health information in order to make an informed health decision. According to a survey conducted by the National Assessment of Adult Literacy in 2006, about 36% of American adults possess basic or below basic health literacy skills. The Healthy People Initiative, through the Office of Disease Prevention and Health Promotion, excuse me, sets to improve overall health and well-being of individuals in the United States. In the latest iteration of the initiative, one of the objectives of Healthy People 2030 is to improve health communication and increase health literacy of the population. So kind of going into our first elective offering, which is simply called health literacy. So this is a 1-week course offered to first and second year students, in which they receive a basic introduction into health literacy. Some of our learning objectives include defining health literacy and numeracy, how to identify signs of low health literacy, and possible consequences of patient misunderstandings in a clinical setting. We also learn about patient communication techniques, such as the teach-back method, and how to develop easy-to-read patient education material, sort of like their final project for the course, which provides them the opportunity to practice plain language communication. And since its first offering back in October of 2022, so far 3 students have taken the course. All right. Next is extended wiki project medicine. So this is a 4-week course offering for 4th-year students, in which they select a medical topic to expand upon using high-quality open access secondary sources. These sources may include scholarly review articles, a medical textbook, information from a professional organization or a government organization like the CDC, Medline Plus, and the like. We also discuss how to evaluate sources for things like timeliness, authority, reliability. Their articles will undergo review 2 times during the course of the 4 weeks, once via student peer review. For example, if there are 2 students in a course, they will just peer review each other's articles, and then again via instructor review. So once the article goes live, it will undergo a second review, checking for readability, use and quality of citations, and overall flow and organization of the article. And once their articles go live on Wikipedia, their articles will reach a global audience, thus helping make health and medical information more accessible to the general public. For this academic year, 23 students have taken the course. And since 2019, when I became the course director, so far 77 students have completed this elective. All right. Next is COVID-19 literature review. So this is an offering to 4th-year students, but I have had a few 3rd-year students take the course for anywhere from 1 to 8 weeks. In my experience, students on average will take the course for 1 week or 2 weeks, depending on how much credit they will need. And kind of an interesting story of how this elective came to be. So to try to make a long story short, it began with an urgent literature search request at the beginning of the COVID-19 pandemic in March of 2020 by one of our faculty members, who is also the state of Michigan's medical director for EMS and trauma, and turned into a project involving a medical librarian and 2 fourth-year students. Daily searches for any literature related to COVID-19 were conducted, originally focusing on treatment or potential treatments, but expanded pretty quickly to include concepts like management, in particular ICU management, neurological manifestations, coagulopathy, just to name a few. These students were tasked with synthesizing the information into memos that were sent along to the state medical director. We recruited some more students to volunteer with producing these memos, and ultimately any further information was communicated through our library's COVID-19 resources LibGuide. So the link is there at libguides.med.wmich.edu/COVID-19 if you're interested in taking a look. And so, by evaluating, synthesizing, and summarizing COVID literature and other sources, students had the opportunity to strengthen their critical appraisal skills of scientific and medical literature and information. The student volunteers had some great ideas on content to add to the LibGuide. And since the summer of 2020, which is when the project became an official elective, the guide was, and still is, mainly student driven. So if you happen to take a look at the guide, I would say at least 95% of the content on the guide was added by students. So it's really cool to have. And this is also a publicly available guide. So anyone in or outside of the WMed community can access it. And since becoming an official elective, 18 students have participated. And right now I'm going to turn things over to Juli McCarroll, who will talk about the electives offered in Spanish.
All right, so we do have 2 Spanish electives, and this is important because if you're familiar with the Census Bureau's American Community Survey, it shows that the US has 239 million English speakers, and the second largest or most spoken language is Spanish with 41 million, and that number is increasing every year. These Spanish speakers were also surveyed on their English ability, and they answered on a continuum anywhere from don't speak English at all to speak English very well. So it is probable that our current medical students will end up seeing these patients in the clinic, and it's important that they are able to communicate effectively with them, build that patient-provider relationship, and have an interchange of health information, and just make sure that they are getting the same high quality treatment that the English speaking patients receive. I am bilingual in Spanish, and I'm the course director for these 2 electives. They are very useful for students who want to examine and improve their cultural humility and their communicative abilities with Spanish speaking patients. The first elective is Canopy Learn. This is an e-learning medical Spanish platform with modules that strengthen reading, writing, listening, and speaking. And it kind of uses role play format between patient and provider, and also a telenovela or soap opera type of series that follows some patients throughout the different modules and levels. So that's kind of fun. Everybody seems to like that part of it. There are 3 levels, beginning, intermediate, and advanced. And typically first and second year students take either levels 1 and 2 or 2 and 3. And then fourth year students take all of them for more credit. One nice thing about Canopy is it has an accompanying free app called Canopy Speak. This is available not only for Spanish, but about 15 other languages. And it has about 5,000 different medical phrases in it. So they can use this while they are taking Canopy and also afterwards to kind of keep up their learning and practice their pronunciation. You just click on a phrase and you can either say it to the patient, you can have your phone speak it to the patient, or you can show the patient the text of the sentence. And after they finish their modules for each level, they receive completion certificates. 20 students have taken advantage of this course this academic year, and 200 overall since it started in 2018. Our other Spanish elective is Wiki Project Medical Translation, and this is the Spanish counterpart to the Wiki project that Anne spoke of already, available for fourth year students. One of the features of this course that students really enjoy is the page views feature, which they can track how many people have viewed the page that they create along the left-hand side on a monthly basis. So they're able to see that the work that they put into these pages is making an impact and people are getting reliable open source health information. One of the things that we try to teach the students is to use, like I said, open access, reputable sources, and also to try and use lay writing so that it's easily understood by the public. One of the things we focus on is improving the readability of the page. And we measure that using the Flesch-Kincaid calculator and other readability calculators and try to get it at about an 8th to 10th grade level. And this elective has fewer students overall because you do have to be pretty fluent in Spanish to be successful in it. So we've had 2 this academic year and about 6 overall since it started in 2019. All right, I'm going to pass it back to Liz.
Thank you, Julie. So some opportunities that we have encountered is that there is a new mission for our medical school. It is to promote health equity through transformative medical education centered around patient and family care in our community. We're really excited that we recently submitted a grant to do podcasting for a mini med school program to reach our underserved population here in Southwest Michigan. Our school is actively participating. Our researchers, our faculty, our community faculty and students in community-based participatory research. And one area that we really shine in is in the area of maternal, fetal, infant care. We're very fortunate that our institution recognizes our electives and the scholarship from our electives as serious scholarly writing. It's part of our promotion, and we add it to our CVs, and we encourage our students to do the same as serious scholarship. And then last, I'm really very excited that my colleague Ann Harris recently earned her MLA Consumer Health Information Specialization. And I'm excited that we have the ability to get this specialization from our professional association, and it just adds benefits to our medical school. We do have some challenges. The electives are optional. Although popular, we don't get everybody to register for the electives. We've also learned that lay writing is challenging. It's very difficult to write at an 8th grade or lower level for our learners. There also is competition from the 7 academic distinction programs, and those programs have electives themselves. And so students may decide with their MD to earn an academic distinction. We've also learned that Can It Be Learned does not meet the local hospital's requirement for medical interpreter. And so although we can give certifications for this program, the hospitals do not accept it. Thank you very much for listening to us. That is our presentation for today.
Thank you so much. All right, and our next presenters will be Rachel R. Walden and Caroline L. Abercrombie.
Thank you.
Thank you.
So hello and welcome to our talk today, where we're going to discuss training future physicians to fight misinformation in healthcare. And I was the course director over the course we built this session in, and Rachel is director of the medical library that we leaned very heavily on, not only for this session and this course, to be honest, but we're only talking about this session today. And so our objectives of our time with you today, we want to kind of discuss our interprofessional approach to developing this session on fighting misinformation for our first-year students, and hopefully encourage you to follow our steed in collaborating with medical educators and librarians when you see how successful it was for us. We also want to share our approach, concepts, and other resources like our rubric that we developed, and of course, reflect on lessons we've learned. So the course development was a very fun path because not only was this a new session, this was an entirely new course and an entirely new curriculum. We are about to celebrate our 50th anniversary here in East Tennessee at Quillen College of Medicine. And I guess in celebration, we're rolling out a brand new curriculum. And to start that brand new curriculum was a 2-week course that I was over. The whole curriculum's charge is that it will be engaging and everything will be active learning. So we knew coming out of the gate that had to be a part of this session. The other key for this entire course was that we wanted to immerse the students in the professional environment, like the learning environment, the resources they were going to have, but also a number of the themes that we wanted to carry with them as they went through their educational career. And there was a working group. This working group really existed mainly of senior students, but they helped recommend some of these themes or lenses that we aim to place on our new students. And they also recommended some sessions. One of those was a session on COVID-19 misinformation. And so that's what sparked the first invitation to the team. Oh, wrong order there. For interprofessional collaboration, because that recommendation was actually provoked by a talk our dean from the College of Public Health had given the medical students. And it was on, of course, a didactic, and it was on fighting misinformation for COVID-19. When we got together, I also immediately reached out to the medical librarians, Rachel in particular as the director, because I knew fighting misinformation, I definitely wanted to know how to best use our medical library resources for this. And when we got the team together, we immediately said, we really should broaden this, go for more broad misinformation topics. That way, depending on the year we deliver the session, we can make it relevant. But also, COVID-19 has a little bit of angst around it. And these are new students. We don't want to put too much negativity and, draw too many lines in the sand just to start out. So our goal was really, some topics that are a little less one-sided or may be a little less argumentative was another thing we kind of mentioned. And so we gave that information to our medical libraries and said, can you help kind of outline some topics that are a little more broad and have a lot of misinformation floating around that are relevant right now? And not only did they come up with some amazing topics, they actually came up with a really great structure to present this information to the students. So it was put in context. They recommended a number of topics, but then they created scenarios, multiple scenarios under each of these topics. And for each scenario, there was at least one piece of misinformation and also one piece of evidence-based information related to that scenario. And so once we started working with that, we realized, okay, now we need to get busy and pull this into a ton of resources because we have a large teaching team. So we knew we needed a facilitation guide to keep us on track in such a short piece of time. And we also knew we needed to give some prep work to these students. They came with a little bit of foundational knowledge before and kind of to start off the session. And so that led us to also saying, oh, we need to make a guide for the students. Just to look at a few of the topics, you see those 4 here. These are the 4 we went with this last year for 2022, and we'll reevaluate that for 2023. And you can see some of the topics under each were kind of what the scenarios revolved around, and those are what the evidence and misinformation examples were provided for each of those individual topics scenarios. And this was actually a really interesting approach. And I think that it really helps the students see examples of what looks like a reputable source and then put the evidence right there next to it. And so let's show you kind of how we approach this. Yes, we had them come in with a little bit up front. We divided them in 4 groups. Let me go back real quick. We cut them in 4 groups based on these 4 topics. So a fourth of the class was assigned to each topic. And you can see in their prep work, we said, hey, you're assigned to this topic, read the scenarios and look at the resources provided for each of those scenarios. After you read this AMA statement on disinformation that was pushed out during COVID-19 for healthcare professionals, just to kind of give them that this is why we're doing this. We brought them in, gave them a quick overview, and then turned it over to our Dean of Public Health, Dean Wyckoff, who gave a 10-minute talk and introduction to misinformation, disinformation, what they are, what the consequences are, and really outline for the students, this is your role as a healthcare provider to fight misinformation. And then we turned it over to Rachel, which she'll talk a little bit more about this in a moment, on how she presented to, this is how you present the information, and also this is how you fight misinformation. The really fun active learning piece was this build an infographic. So they got into small groups. We broke that quarter of the class down into smaller groups, and they each had to pick a scenario to make an infographic about. Now, actually picked this up through more interprofessional collaboration. I had done a course with PhDs, College of Public Health faculty, College of Pharmacy faculty on COVID-19 for our clinical students. And during that time, our public health faculty had shared an activity with us that she developed by working with the health department. The health department would come up with infographics that they needed, and that would be relayed to her infectious disease class. And they would make infographics that would meet that need and were evidence-based. So we kind of took that into that COVID-19 course, formally adopted it and started to adapt it to what the needs were for that course, and then adapted it even more for the needs of this session, which includes this rubric you'll see right here. And we kind of had divided up the work amongst our librarians as well. We assigned one of our medical librarians each one of those topics. And so we really pushed the students. We gave them a few tips before we just set them free to make this infographic. One of them, read this rubric. Make sure you understand our expectations. And the other one, use your medical librarian because they are a great resource. And then we actually gave them a free software program that is for graphic design so they could quickly make an attractive infographic as well. And so I want to walk you through this activity rubric so you can see how we're kind of introducing them to this is how you fight information by, aligning the expectations early and then assessing their infographic with that as well. Evidence, of course, everything's evidence-based, but also we encourage them to cite that, as you can see what our highest expectation is. And then identifying your target audience and that you have an appropriate mode of delivery for that target audience. If they don't have Wi-Fi and computers, email may not be the best direct line of communication, for example. Delivery, literacy level, as we just heard, is key. Did they meet that goal? And do they have a clear plan for getting that out? Creativity and formatting, of course, it needs to be engaging, appealing, and creative to grab the eye and get that target audience to even look at what they're making, and then relevant, which we took a little bit of guidance with, of course, because we gave them the global topic, but then they had so much power to redirect that we still felt that this was key. So our student and products were really great. And I think that there's some things that we did to help with that. First of all, that free online graphic design tool was key, because when I show you a couple of these products here in a minute, with only 30 minutes, I think having some templates and easy graphics really helped them feel good about the product they pulled together. They were able to export the PDF and PNG files very easily. They submitted those on a discussion board that everyone could see. And then we had a challenge across all their learning communities, who had the best one. And the medical librarians used that rubric to go through each of these and, outline who they felt the winners were. And you can see one of our top performers here. It looks beautiful. It has great information, nice citations from very reputable, good resources. They're not just Google searching, which really made me happy. And then you can also see that, I clicked too quickly. This is something that they plan to actually put up as a flyer and print out and also push out through social media. When you won, the award was to be put on our social media and pushed out, actually. And so the winners were put out into the social media network for all to see. And now I'm going to hand it over to Rachel to talk a little bit more about how the topics were defined and how we talked to them about presenting their information.
Thank you for that. And Caroline, before you mute, there was a question about what the free graphic design tool was. I believe that was Canva, was it not?
It was canva.com. Great free resource.
Great, thank you. So just to reiterate, the librarians were very heavily involved in this session, and that was a great interprofessional opportunity for us, and also just the enthusiasm we all have for combating misinformation. I think it was fun for the librarians to think about how to work with our first year medical students about this kind of subject matter. So as Dr. Abercrombie said, we did help identify some topics where there's frequently encountered misinformation. Could you go back one, please? Thank you. And then we also identified for them, some of the myths that are out there, and then some of the sources of high quality information. That gave them the pre-work to do, gave them a chance to think about their topics, but it also gave us a chance to not overwhelm these brand new medical students by not asking them to understand what misinformation is, figure out what misinformation might be out there, figure out the right information just from the get-go. We wanted to kind of just show them what that looked like. And then I did that didactic to the class, which I'll talk a little more about on the next slide. And then our librarians also served as small group support as the students worked on those infographics. So we had a librarian assigned to every 1 or 2 groups, I believe, to the students as they worked in small groups. And we kind of hung around and watched them work. And that was actually great to listen to them work together and get to know their new classmates and think about how to get this done in their time. But it also allowed us to address more information questions. So students might run into a source online about the topic that they were looking at and say, hey, can you help me look at this? I'm not sure if this is really good information or not. I'm not familiar with this organization. So those small group interactions gave us opportunities to just further reinforce what we talked about. Next slide, please. So in that didactic, it was, it was fairly short, and this is a big topic, as we know this, with this symposium, we could talk about this topic for 2 days. But there were a few key points I wanted the students to walk away with. One, there are a lot of reasons why what they think they know or what people think is known about a medical topic could be incorrect. That could be misinformation. It could be disinformation. It can be straight up propaganda. It could be that what you knew used to be correct and now it's out of date information. Of course, we all know there can be bad research studies that get published. There can be misinterpretation of the findings of a good research study. That comes out a lot in the media. You'll see shiny headlines about a study that's been published and find out that if you dig in, it really doesn't mean
what all the splashy headlines are telling you. And there could be new information that they need to know. So we wanted them to really start thinking about practices for fighting misinformation throughout their whole career. So we talked a little bit about keeping up with new evidence. How are they going to do that? How important that is. We talked about the need to apply principles of evidence-based medicine, knowing they will learn more about that as they go through their studies. We reviewed some of the key resources and talked about the right resource for the right question. So, what types of questions do you go to PubMed for versus what kind of question do you maybe go to a government agency for? Where can you go for some of that complementary and alternative health and supplements and that kind of thing? Who's going to be addressing some of these topics in an evidence-based way, and how do we find that? And then we talked about how are you presenting information, because the communication part is so important. Our students need to have correct evidence-based knowledge in their minds, but if they are not able to communicate that to someone else, then that is really hampering their ability to act as a future physician. And we did anchor that in health literacy principles. I do teach a 4-week elective to our 4th-year med students about health literacy. And so I just brought some basic principles back, really focusing on that clear, plain language and that actionable information. And then sort of gave them a framework for thinking about this throughout their careers. Next, please. So that framework, we want our students to become excellent lifelong learners and stay evidence-based. And so I wanted to present this to them as sort of 4 questions they can stop and ask themselves so that they could go beyond just what do I know? There's a lot of emphasis in medical school on what do you know? Do you remember everything for the test? Do you remember everything for your boards later? There's a lot of cramming facts into their brains, but they need to go beyond that. And they need to be able to stop and say, maybe I don't know everything. So the questions are, what do I know? But then what do I still need to know? I wanted them to get used to thinking about themselves as not knowing everything all the time, which I think is really important. And then where could they go for evidence-based information? And then how do they communicate to others what they've learned? And to me, that final piece of, okay, I know this, but I need to be able to communicate it to others effectively is just so critical for their work. And just want to encourage them to sort of close the loop by thinking about that piece and not just thinking, what do I know, but how can I convey that? I think if we think about, COVID-19 and all the questions that came up about vaccines and treatments and things like that, I think we could all agree, our physicians could know everything, but they need to be able to explain it to us as individuals and get messages out to society that help people understand that. Next. Oh, and now I'm turning it back over to Dr. Abercrombie.
I'm going to remember to unmute myself. So let's talk about lessons learned. There were a number of strengths, definitely the collaboration piece, because the students loved the infographic activity. But, you can see from some of the other strengths I'm going to go through from the evaluations, they saw benefit in it as well. And without the support of the medical library or the support of my colleagues, we never would have been able to get here. And I can say that about a number of sessions in this course, honestly. So I just want to promote collaborating with every resource around you, definitely. The freedom of design, kind of with the competition as well, I think really helped engage the students. They had a topic, but they could choose from multiple scenarios. They could choose from whatever they wanted to make, whether it be a pamphlet, a flyer, or a social media post. And then the competition. Friendly competition always helps with medical students and their type A personality. So we saw students that wanted to work on it further, even after the session, and asked to turn it in after they got together that evening and worked on it a little more. They were that competitive. So they were definitely engaged. The introduction to types of misinformation and the consequences being detrimental or less detrimental is actually mentioned in a narrative comment for the entire 2-week course, which I found very impressive. Also was the introduction to library resources being beneficial because they did it in a way where they actually had to find and use the resources. Yes, they were provided, but Rachel gave them a background to what they were provided, why they were provided, and how they could best use it. And I think that really gave them an introduction that made them more comfortable to using those resources, was what we saw in their narrative comments. And then someone even replied that they really felt it conceptualized the topic for them, which, you know, those scenarios, I think the approach that they came up with, putting it in the real life scenarios, I think that's what really made it real. Limitations. Yes, this is placing a lens. A lot of that was because where we are in our curriculum. So we're not asking the students to identify information versus misinformation. We're really just placing the lens of awareness that there is misinformation. You need to look for it, and you need to know how to fight it appropriately, because there are consequences. I think that we were really intentional where we placed this up front, but we are not right up front. We had other sessions where we gave them time to get to know each other a little bit more, feel comfortable sharing and working together. And we even had a history of medicine session where they saw, oh, like things change. Like we used to think this was helpful, now it's killing people. So they really had an understanding, like it's not just us, it's that the field advances. And then we've only delivered one session, but the entire course was very successful. We definitely are getting together to collaborate again. But again, just under 80 students for one session is all we've done so far. But thank you for your time, and we'll take questions.
Thank you so much. So we'll open it up for Q&A for both of our presentations today. So we did have one for the first presentation. Did you develop your own curriculum for these courses, or are you using something that was already developed?
So for the wiki courses, and I think this was for the wiki translation course as well, it was already developed. So actually, Juli and I began at WMed at about the same time, and a few months after we began working for the school, we were made course directors for each of these wiki courses. So the courses were already built. And the health literacy elective, and you can correct me if I'm wrong, Liz, I was given an outline for a potential health literacy elective that I think was supposed to be, it was several years back, but it just never came to be. So it was that course was, the idea was there, long story short. But yeah, so as far as the other two, like the wiki courses were already built, because before Juli and I came on board, there were instructors. I don't know exactly when the wiki courses began.
Yeah, if you are interested in the wiki course, it is a project of Wiki EDU, and you can just go to wikiedu.org to learn more about that one. And if you're interested in the Canopy Medical Spanish, they are at info.withcanopy.com.
Oh, Liz, did you have a
comment? Sure. So it's kind of a funny story about the health literacy elective. It was developed in 2014, and it was actually on the last page of the course catalog, and whoever was assembling it left the last page off. So there always was an elective. It's just the students didn't know about it. And when Anne told me about her background and specialization, I was like, we have an elective that no one knows about. And then I will make a comment. The COVID-19 is what you created that. Yes.
Yeah, that was, so the COVID-19 literature review project / elective, it began, like I had mentioned, back in the beginnings of the pandemic, just as a 3-person project that kind of turned into, I think eventually we had 12 student volunteers that were, helping input information onto our LibGuide. But yeah, the LibGuide itself, as mentioned in the presentation, what's really, really cool about it, and I think it's something I'm definitely proud of, is that most of the information that is presented was added by students. So this was and always had been a student-driven project / elective. It originally, the LibGuide itself was originally meant for clinicians and had very little information. I think one of the first requests we had for that guide were ICU books. And so, once once we had more student volunteers and then elective students, they added information to that page. They helped maintain, the information on the guide. Yeah, it's so it's still ongoing. And yeah, so so that particular elective was pretty much built from necessity, really, and became a credit-bearing elective for our students.
Thank you so much for answering that. So this next question is for everyone. Did you find the students had time to take the courses?
Should we
Sure.
go first?
Sure. So here at Western Michigan, Homer Stryker MD School of Medicine, there's a course catalog, and the M1, M2, the first 2 years of medical school, they have 4 elective weeks, which are 30 hours each. It used to be you could take any 4 electives you wanted to. And then when we had COVID, you had to take 2 clinical and 2 non-clinical, and that has actually stuck. So we have there isn't very many non-clinical faculty at a School of Medicine. So all 9 of us got together to offer these non-clinical electives, and they've been really popular, as you can see with our numbers, and they're actually through word of mouth. We do not have to advertise for students. We have students. We always have at least 1, if not more. So I know for a lot of schools, 1 might not seem a lot, but for our school, one is a good number. So we also have we don't have third year, but we have 4th year electives. And those electives, again, vary by weeks and hours. 1 week can be 45 hours, and they can choose from 1 to 8 weeks. So they have a big variety there. So next year, with our new class of 2027, they actually can take electives all 4 years. And so we're going to look for opportunities there to be teaching all 4 years of medical school, which is really exciting. We are not increasing our electives because it's just the 3 of us, and that's all we can do right now. And again, it's all through word of mouth. And so people have we have really high positivity. We get really strong marks. And we ask the students to tell us, like, what do you want it to look like? How can we do this better? And they've been really, as you know, medical students are really good about giving you really good feedback to making things better and what they would like.
In response to the same question on our behalf, yes, they had dedicated time, so they showed up. Our biggest issue was that I did not look at the prep work they had for the entire day. And I gave them a little too much preparatory work, and it was a little overwhelming because it was their first day of orientation where you sit there and go through all of the basic campus security and tours and resources. So they got out later than they did on most days and had a lot of prep work, because this history of medicine topic that went right before it, which now were 2 separate days, had a similar approach. We had actual medical museum artifacts. And so we split them up among those artifacts. And then we had links to, this is how it started. This is how it is or is not allowed to be used. any longer. And so they looked at some of those in advance. And so we provided just a little bit too much preparatory material for the day was the main thing that was inhibitory time-wise to our students. But that's one of our adjustments for the this year moving forward.
Thank you so much. Our next question for WMed, I noticed you offer credit. Do you offer this course to non-medical learners as well, or is it only offered to medical learners?
It's only offered to enrolled medical learners in the medical school. So we don't accept away students or community.
Thank you so much. And we have about 8 more minutes or so. So if you have any more questions, please feel free to put them in the Q&A section.
Oh, I see a question. Do you have suggestions?
Yep. Do you have any suggestions on replicating a health literacy education workshop for the public? Is that for, I guess, y'all? Is that for Rachel and Caroline?
Rachel, you teach
anyone. Okay, anyone can answer. Okay.
I'll be happy to talk about that. I think it's really dependent on your audience and the amount of time you have. You know, are you doing like a one-off with public librarians, or are you doing something with the general public? Or but I would say there's so many great resources out there already, and I try. I teach a 4-week elective for the 4th year med students, and really try to build on a lot of the materials that are already out there for free, whether that's CDC, Health and Human Services, other organizations. And so I would definitely, if someone wants to create a workshop on health literacy, I would definitely say, like, use your existing tools. Don't try to do absolutely everything from scratch.
I just want to add something that we're working on that we hope to offer in the future is a podcast series with our learners. So we'd have an elective where our learners would be writing the script of the podcast series at a appropriate consumer education level. And then we would record the podcast and then disseminate them through our community. So we would work, our school has a clinic, and so we have the ability to reach our patients through that population. And so it just allows us to be a little bit more agile and so people don't really have to come to the clinic or the school. We don't have to go out to the public. And people can listen to these podcasts at their on demand. And so that's what we're hoping to do with the mini medical school pilot project in the future, is podcasting.
That is amazing. I love podcasts. So look forward to sharing that out and supporting that. Any other questions? Oh, Rachel is great to work with. Oh. Okay, well then I'm gonna. Oh, what's the name of your podcast? I don't think it's been out. It's not released yet, right?
We haven't released it yet. No.
Okay. So there's not a name yet.
It will be the WMed Health Mini Med School. Once we get kind of rolling on that, we hope to, the community will take the podcast and be able to enter like a CME code to get credit. And we hope to give them a WMed Health Mini Med School diploma, which I think will be really cool especially for our community. If you're not familiar with Kalamazoo, we are the home of Pfizer and Zoetis, and in our community, we made the vaccination for COVID, and we're really proud of that. We're also the home of Stryker. So if you've ever been in the hospital in a bed, you've been in a Stryker bed. So there's a lot of pride and joy in our community, and there's a lot of people involved in healthcare and biomedical science and biomedical engineering, design, people who do manufacturing. So there's just a lot of people being really proud of what we do. So I know that just kind of temperature checking, there's a lot of patients would be like, it'd be so cool to have a WMed Health diploma.
That is cool. Thank you. Okay, so let me wrap this up here. All right, so thank you for attending. And if you would like to get the Medical Library Association continuing education credit for this session and others, you will receive an email after this symposium ends with a questionnaire and instructions to claim CE. You have about 30 minutes until our next session, and we encourage you to visit one of the booths for the event, then maybe get away from your computer, move, stretch, get a drink, and maybe go outside if it's not raining or you're in Kalamazoo where it's a little scary right now. But thank you for joining us today on our second day of the Health Misinformation Symposium. And let me tell you about our upcoming events. This series features presentations from expert guest speakers and will enable librarians, public health professionals, health educators, and healthcare providers to explore various aspects of health misinformation, disinformation, and malinformation, and learn practical and evidence-based solutions for how to identify it and help curb its spread. These presentations will be scheduled intermittently throughout the year, and you can learn more about upcoming sessions by clicking on the NNLM training calendar. So hopefully you can check those presentations out as well. And thank you again for attending. And thank you to our wonderful presenters. Thank you.
Thank you.
Bye, everyone. Oh, bye.